HIV, human immunodeficiency virus, is a virus that attacks the immune system, making it difficult for the body to fight off infections and diseases. HIV is primarily spread through the exchange of certain bodily fluids, such as blood, semen, vaginal secretions, and breast milk. The most common modes of transmission are through unprotected sex, sharing needles or syringes, and from mother to child during pregnancy, childbirth, or breastfeeding. HIV can also be transmitted through blood transfusions or organ transplants, though this is rare in countries with screening programs. HIV symptoms vary from person to person and can include fever, fatigue, rash, and swollen lymph nodes. Some people may not experience symptoms for years, but can still transmit the virus to others. There is no cure for HIV, but antiretroviral therapy, ART, can suppress the virus and prevent the progression to AIDS. ART involves taking a combination of medications daily, which can have side effects, but can help people living with HIV lead long and healthy lives. HIV can be prevented by practicing safe sex, using condoms, not sharing needles, and getting tested regularly for HIV and other sexually transmitted infections. Stigma and discrimination towards people living with HIV/AIDS still exist, which can prevent people from getting tested, accessing treatment, and living full and healthy lives. HIV/AIDS disproportionately affects marginalized communities, including men who have sex with men, transgender individuals, sex workers, and people who use drugs. The global impact of HIV/AIDS is significant, particularly in countries with limited resources and high rates of HIV/AIDS. In 2020, approximately 38 million people were living with HIV/AIDS worldwide, and 690,000 people died from AIDS-related illnesses. HIV/AIDS research is ongoing, with a focus on developing new treatments and vaccines, as well as understanding the social and structural factors that contribute to the epidemic. HIV/AIDS advocacy and activism have been critical in raising awareness, challenging stigma and discrimination, and advocating for access to care and treatment. Despite the challenges, progress has been made in addressing the global HIV/AIDS epidemic, with reductions in new infections and deaths in recent years. Continued investment in HIV/AIDS research, prevention, and treatment is essential to ensure that progress continues and that people living with HIV/AIDS can live full and healthy lives.